Hi, my name is Stephanie, and this is my project on hypertension and the use of the DASH diet. The number one problem for patients who have high blood pressure is keeping it under control. And it's really unsure if any of the antihypertensive drugs help moderate hypertension for the long term. And it's said that improving one's diet habits may help alleviate hypertension altogether. For background on hypertension, high blood pressure puts you at number one risk for heart disease and stroke, as you can see in the chart. Many places in the South are at high risk for hypertension, or it is prevalent in that state that there is hypertension. It is the leading cause of death in the United States. Many Americans don't know that they have hypertension because there are no symptoms for it, besides getting your blood pressure checked regularly. And about 32% of American adults have high blood pressure, which is 1 out of every 3 adults. High blood pressure also costs the United States an average of $48.6 billion each year in healthcare costs. And it is important that the DASH diet plays a role in the improvements of blood pressure. The DASH diet is a dietary approach to stop hypertension, and this diet is low in saturated fat, cholesterol, total fat, and it really emphasizes fruits, veggies, and fat-free or low-fat milk and all milk products. It also includes fish, poultry, whole grains, and nuts. And there is also a reduction in the lean red meat, sweets, added sugars, and sugary beverages. And finding this diet to be high in potassium, calcium, magnesium, as well as protein and fiber. Overall, a pretty healthy diet for one person to follow. Chobiani found that there is remarkable advances for lowering blood pressure and hypertension, but it continues to be a huge health problem because people don't adhere to certain diets or exercise routines. Mainly people manage their hypertension with a drug because it's a lot easier and they don't have to change their lifestyle, when in fact it is their lifestyle that they should be changing. It is found that failure to adopt any healthy lifestyle has a critical factor in the increase of hypertension in the United States. Beckett and Associates did a study where they treated hypertension in patients who are 80 years or older, and they found that they used a diuretic or a matching placebo, and they found that an antihypertensive therapy may reduce the risk of stroke, and they found the diuretic to be beneficial in an antihypertensive treatment versus an antihypertensive drug. Appel and Associates did a study where they did a dietary approach to prevent and treat hypertension. Initially, dietary changes are tried, and that first before antihypertensive drugs come into place. The DASH sodium trial reduced sodium intake significantly and lowered blood pressure in each of the major subgroups studied, which were men, women, blacks, and non-blacks. And as for dietary modifications, they found that a lower blood pressure, reduced salt intake, increased potassium, and a moderation of alcohol consumption were lowered, and this pattern was known as the DASH diet. Chu and Associates compared the DASH diet and a higher fat DASH diet on blood pressure and lipids and lipoproteins. These were tested to substitute for full fat dairy foods in the DASH diet with an increase in fat and a reduction in sugar intake, blood pressure and lipids and lipoproteins. The high-fat DASH diet actually lowered blood pressure almost the same as the DASH diet and reduced triglycerides without increasing the LDL cholesterol. Also, Appel found that hypertensive individuals who are older age and Black are groups that are sensitive to effects of diet on blood pressure. And then the evidence from clinical trials has seen a reduction in salt intake, increased potassium intake, and the DASH diet are the most effective ways of reducing blood pressure. My research hypothesis is that the DASH diet will change hypertensive patients' blood pressure, and the null hypothesis is the DASH diet will not change hypertensive patients' blood pressure. For my method of study, patients from the Heart Health Institute in York, Maine will be volunteering. These patients will be in the pre-stages of hypertension or the stage 1 hypertension, and their ages are from 40 to 50 years old. A sample size of 200 subjects, according to the G-Power technology, was used, and they also have to have increased blood pressure levels of the last 6 months. For my design, the subjects are going to be assigned a control group or an intervention group. The intervention group will be reviewed with a registered dietitian on the DASH diet education every month for an hour over a 6-month period and an hour for our baseline, and entering food intake into the American Heart Association's food diary that will be provided. In the control group, no intervention, we're telling them to continue their diet and exercise program. For data collection, measurements of blood pressure, cholesterol, height, weight, and food diaries will be collected. The measurements will be taken by trained staff and doctors. Measurements and food diary will be submitted at baseline, 3 months, and at 6 months for the study. The data analysis will be a two-tailed t-test comparing mean blood pressure levels pre- and post-intervention. Ethical considerations, an IRB will be filed. Volunteers are free to leave trial when they feel necessary. A food diary as an inconvenience, and DASH diet may make other daily activities difficult. Food diary helps with adherence to the study, and healthcare professionals are more aware to provide DASH diet education when working with patients who are hypertensive. And this allows for the community of the Heart Health Institute to see changes in blood pressure levels and to continue the DASH diet for a long-term solution. And the limitations of the study are, again, adherence to the DASH diet, logging food diary properly, the lack of convenience with this diet, making meals yourself puts a lot more effort into your daily routine. The DASH diet is also not specifically designed for people who want to lose weight. And another thing is flavorless meals because of lack of salt in this diet. Spices are used for an alternative, and major changes in activity level and diet. And here are my references. Thanks, guys.